of equipment and technology solutions for a successful dental startup. We're going to get started here in about 2 or 3 minutes. So go grab your glass of water and I'll see you back here in 2 or 3 minutes. All right, everyone. So let's go ahead and dive in and get this thing started. Again, my name is Scott Leune, and thank you so much for attending this webinar. And as many of you know, that we're trying to roll out just these webinars every couple of weeks to try to bring more value to everyone. So I hope you guys are finding value in this. I'm excited about this webinar because this is the first time, and maybe the only time, a company is going to come on here that sells us equipment and show us how to actually save money. So I'm very thankful for DHP, which is an awesome dental equipment supply dealer. And I'm also thankful for our guest, Greg K, who's going to be walking us through kind of the latest options when it comes to some of these larger equipment choices with our startups. And specifically what you're going to see is a no BS kind of way of talking about cost of things and where we could save money and what is reasonable with today's technology. And of course, in the environment of equipping for a startup, a budget conscious startup that's trying to do it the right way, trying to save money, trying to build something nice. So I'm going to go ahead. Greg, thank you so much for joining us. I'm going to go ahead and turn this presentation over to you. So it's all yours.
Thank you for having me, Scott. I really appreciate we at DHP really appreciate the time. So the biggest thing for me when it comes to talking to any startup practice or dentist that are looking at startups is really reprogramming their minds. And what I mean by that is a lot of times larger vendors talk about really, really expensive equipment, really, really expensive cabinets, and those type of things. And if you think about it, I mean, budgets are getting slimmer and slimmer with construction costs. So really, the reality is if we can focus on Toyota-based products, which are just as good, it really helps us then get the products that actually impact the practice, which is CBCT, scanners, and technology products. Because the goal is as much as patient impact products we can get into that new startup is really what our goal is.
So yeah, so you're talking about, I'm sorry to interrupt, but you're talking about like the Toyota kind of level. So something brand new, something that works really well. It's high quality, but it doesn't cost the same as like a Ferrari, right?
Correct.
So what would be an example, just a generic example of like a typical kind of chair cost that would be the dental Ferrari version that so many dentists get versus a typical chair cost that might be the Toyota version, just to kind of get our listeners here, in alignment here with what we're talking about.
Absolutely. I mean, a decent chair with just a chair by itself, no unit on it, can be in the mid threes to high threes for I would say a decent product, up into the mid fours. Whereas a high, like you say, the Ferrari products that we see out there a lot that are being spoken about can be up to 10K, even I've seen even 11K just for the chair. So that's a huge difference when it comes to 2 or 3 rooms and making a huge difference on the overall cost.
So when I walk into offices, I mainly see the $11,000 patient chairs. I rarely see the $4,000 patient chairs. What's the difference between the 11 and the 4?
I mean, reality is, patients when they're sitting in chairs don't really care what that chair is, as long as it's decently comfortable, which they all are. I mean, yeah, it's like anything else. You could drive a Toyota, go from point A to point B, right? We could also drive a Mercedes, but at the end of the day, that patients don't really care about the chairs. They want a nice, clean office, and they really want something that's comfortable. But the reality is, they're not even really focusing on that chair at all. So I don't see a huge difference, frankly.
So the $4,000 version and the $11,000, they both go up, they both go down, they both lean back, they both have comfortable seating for a patient, they both get the patient where we need as a doctor the patient to be. Are they both serviceable?
100%. I mean, they all have, whether they're made in China or whether they're made really anywhere else, all these companies are American-based companies when it comes to their parts. So really, that's the key. I mean, the parts have to come from a distribution point. It's not like they're having to send them from overseas into the U.S. They're already here in the U.S. So it's not a huge difference when it comes to getting parts and availability for parts to get it fixed.
Okay. And I forgot to mention earlier for the listeners, if you have any questions, please type them in the chat. We will get to the questions by the end of this session. Also, there's a couple different offers that are going to be given to you by DHP and by my education company at the end. And we'll give you some instructions for that as well. So stay to the end, type in your questions as you think of them. So Greg, what you're saying is, the larger companies that sell dental equipment, I won't name any companies, I won't name any brands out of respect for those companies, but we all know the brands. We all know the names of these companies. They are selling a whole lot of dentists $11,000 chairs where they may not even be showing these same dentists the $4,000 options. And these $4,000 options are brand new. They look good. They function well. They're supported by and serviced by the people in our area that work on equipment if ever needed. The parts come from American companies. So basically, we dentists haven't been buying these chairs. Would you say primarily because we're not shown these chairs?
Absolutely. I mean, and the very thing is that all those vendors could easily sell these products to any prospective buyer. They just choose not to for all the reasons that you spoke of and above. I mean, and really it comes down to, because budgets are really, really slim. I mean, every $1,000 means something. And so to me, when you're looking at, I'd rather have a dentist have as much technology and I would say patient products that make a huge difference on the way the patient looks at things. The patients don't really care about the chairs. And I also think that less cabinets are also, less is more for me for cabinets too. I see cabinet quotes that are unbelievable. I mean, and so by the time you put 2 chairs in, really that dentist can only probably get 2 rooms of equipment because they're so bloated on the costs on the chairs and the cabinets that it makes it almost impossible to get technology products that actually matter in that practice.
So I'm gonna quit interrupting you so much so you can keep on going. But you mentioned something pretty significant. You said, I would rather a dentist get appropriately priced chairs and have that savings be applied to technology like CBCT or scanning or printing, as opposed to burning the entire equipment budget on just 2 rooms of equipment of very expensive chairs. And most dentists don't know that's what they're actually doing because those are the only options they've seen. That's significant. All right, continue.
Yeah, no problem. So as you can see, even this picture, I mean, this is what I have always believed in. I mean, I have always believed in less is more when it comes to cabinets, because really in reality, if you have less cabinets, it means we can also get more treatment rooms in a smaller footprint. Whereas I see projects all the time where I have a bid from somebody and I also see a floor plan, and what we could easily gotten 6 chairs in there, maybe there's only 4 chairs in there because you have side cabinets and all the other different cabinets too as well. So again, those not only cost more, but also you're limiting yourself on potential having more treatment rooms too as well. Next area, I mean, really the biggest thing is also redundancy. I see very, very specific rooms. So they have like hygiene room, for example, is one style chair. And then they have the doctor's rooms, a different style, a different setup. I like redundancy because frankly, if an operatory does go down and you make everything interchangeable, it doesn't matter what room you're in. You can easily flip a hygienist or a dentist to another room if you make things very consistent. And we also see a lot of times where they have, I call Pacific rooms, equipment that is sold specifically for a hygienist or specifically for a dentist. And I really, really think that is not a good idea at all. I think your rooms should be interchangeable. I think you should be able to, without missing a beat, move somebody to a different room without having any kind of, problems in the practice of being shut down.
Yeah. The photos you're showing, these chairs look like nice chairs. And, I wouldn't even know that's not a $11,000 chair. And then you're showing cabinets, and what I'm not seeing is all the side cabinets you talk about. What might a side cabinet, like a dental side cabinet, what might that cost?
I mean, they could start minimum $5,800, but they're more like $7,000 or $8,000. I mean, which is reality is, I mean, when you're looking at a startup, you only have a certain amount of money. And it seems like a lot when you're getting a loan from a bank, but it goes fast with construction costs. And reality is, I mean, that's a chair. That's more than a chair.
Yeah. So let's like do some math real quick. So if each side cabinet is $6,000 and a chair is $11,000, and the 12 o'clock cabinet, many times that might run what?
Those like 5,000 to 6,000, even 7,000. I mean, or more sometimes.
And then we've got like a delivery unit on top of that. We end up with like just the chair, the side cabinet's 12 o'clock cabinet can be like $35,000, even more of equipment. But what you're describing is a brand new $4,000 chair, no side cabinets, and maybe what 6,000 at the 12 o'clock, 7,000 including delivery. Is that a good estimate?
Absolutely.
So instead of 35,000 just for those things, we might be at 12. Or in other words, instead of spending all that money to equip one op, we could have the same amount of money equip 3. And then all of our other budgeted equipment money could go to the high technology stuff that you've talked about. Did I do that math correctly?
Yeah, absolutely. If you think about the overall budget for equipment, probably in reality, by the time you get construction costs, marketing, all things that actually matter in this starting to practice, it's probably more like the 150s, the 130s, the 180s, the maximum. And so when you do a room like that with all that equipment, you pretty much cannot get any technology products or really things that actually impact that patients coming into your practice, and also getting staff members that actually want to work in your practice. Because everybody works for a high-tech practice or go to a high-tech practice when it comes to patients or staff.
Yeah. So I know this is just a webinar, and I know we're just looking at a few slides, but the significance of what you've just said is immense. The significance is we could spend a third as much on brand new equipment that gives us beautiful operatories that allows us to treat patients. A third as much. I think in any other world, if we talked about like saving someone, $80,000 or $100,000 of actual like real savings, that would be an immensely important thing. And we're kind of saying it real quick, on a random, Monday on a PowerPoint slide, but this is at the foundation of, how a lot of startups are able to get open in today's budget world and still open with all this high tech stuff, this CBT and scanning and printing and, electric handpieces, everything we would want. We're able to afford that on a startup budget if we don't go blow the money on some of these core things that a whole lot of dentists just blow their money on. All right,
Really?
Back to you.
Yep, absolutely. So the lab area actually has sort of evolved a lot too. In today's lab, I mean, I think labs get overlooked quite a bit. They try to cram a small lab into a space. They don't even think about linear space as needed for 3D printing and also the things I would call the digital lab actually needs in today's world. So a lot of labs I see that have like, a really tiny lab, but it's not if a dentist is going to go to 3D printing, it's just a matter of when. And really, it's a matter of how many of them. So even if you look at this lab actually, I would say is generous in size compared to what you normally see. But even this, you can see they don't have a whole lot of space left on that lab, right? And so I've even encouraged people to even do almost like a stereo stack rack where you basically have vertical space because they really need that space for 3D printing. They really need that space for dust containment and different things. And so the lab really has gotten overlooked quite a bit, and you really can't do that anymore with today's dentists. And then where do you put all this 3D printing stuff? I mean, there's no other room for it, and no one really even thinks about that kind of stuff in their design. And so I really encourage dentists to really take a long, hard look at their lab and make it more digital for them versus a small little lab that nothing goes in there.
So like this photo, like what would people typically store in the upper cabinets of a brand new practice's lab? I don't even know. So what you're saying is, assuming here we can store our dental supplies in a proper way, like what we teach through our events, the lab could be almost like what's become in the sterilization center where you have autoclaves on top of each other. We could potentially have technology like 3D printing or milling and things like that designed in cabinets on top of each other so that we still, if we only have a modest footprint for the lab, we can use height and we could have kind of these towers of technology. Did I describe that correctly?
Absolutely, because you need the linear space, whether it's vertical or as you can see in this counter. But this one's pretty packed. I mean, you have a lathe in there. You also have a etcher. A lot of people are doing etching. You have the cure and the wash for the 3D printer, and then you have a lab vacuum system with a workstation there. And then you really kind of need that for, I would say, today's digital lab. And so, yeah, you're absolutely right. You just need a linear space, whether it's vertical or counter space.
It looks to me like, if I had to guess, it looks to me like that is about 10 feet or so of counter space, maybe 11, and almost all of it is full. Is that about correct what I just said?
Yeah, and really most labs I see are really from that about probably maybe half of that, maybe a little bit more than half of that, and that's not enough.
Yeah, so like 7 or 8 feet is a typical lab, and they're running out, and that doesn't even include a sink, right? This is just counter space. So in kind of the trend that's happening is we need to dedicate more footprint space to the lab if possible, and now we've got to get smarter with the cabinet design to stack technology in a kind of a modern way, as opposed to just like haphazardly throw upper cabinets and base cabinets in there and call it a lab. Right.
Really, reality. I mean, I don't know what the upper cabinets would be really used for because you have plenty of space down below. And so I would rather have shelving in there or something like that where it's actually useful. But, in this case, I mean, this is actually a better lab than what we normally see.
So you might have the ideal lab might have like the towers for 3D printing and from milling going higher as opposed to lower. And on the base, we might have drawer banks of storage, different size drawers to store, whether it's blocks or dyes or all kinds of things with porcelain, everything we use in that side of the world. And then we would also still need, of course, counter space. So would 12 feet be, if we stacked some technology, would 12 feet of length be an appropriate size for a lab?
Yep. I would even encourage you, which I know you love, tip-out bins, because then you can actually physically see all those resins, those things, all those items on the wall, and which is kind of falling, which is way better anyway. But yes, you are right about 12 feet.
Yeah. So that's an important point, because if we use tip-out bins as a backsplash, and we could use the smaller ones because these are all smaller like pieces and parts we're storing, then we could potentially have two kind of phases of a lab. We could have the towers that's storing the equipment, and then we can have kind of the open counter space that has upper shelving and lower drawers, and the tip out bins become the backsplash for these smaller items. Would you agree with that statement?
I would. And also I would have open, which is a counter, like as you see where the sharps container is in that lab vac. You really need two of those because you need a computer in today's lab eventually, especially if you're doing 3D printing or nesting things and probably doing design, or even having a 3D printer plus a mill. We wouldn't be able to put a mill in this setup at all. So you're all right. I mean, you just need that linear space.
So everyone listening to this, think about where you work today and think about that lab. How clean is it? How modern is it? How organized is it? Can you put some 3D printing and some milling units in there? And what would it be like if that was actually correct? If it was your practice, if it represented an extension of you and of your dentistry, of your reputation, you had a modern practice and you got to kind of create this lab setup from scratch to incorporate these types of things, technology, it would probably give you some energy and excitement to like do it this way. Also, when you have a clean, modern, organized space, it makes you want to do these types of things. It makes you want to be this kind of modern dentist. So, I think it's important sometimes to remember how bad it is where you are today so that you can understand the impact that this would have if you finally practiced in a space that made you proud and you were organized and you felt comfortable with doing it. All right, let's continue.
So sterilization area also has evolved too. One of the things I like to bring up is just the sterilizers themselves have really, really evolved. As you can see on the screen, this is dry heat units. And so in our world, we all think that steam is the only way to clean or use for sterilizers. And dry heat has come out and it's been out for quite a while. Most people just have in their head that M11, for example, not the single that's a great product, but everybody thinks that steam is the only way to go when it comes to sterilizers. It's actually not. I mean, dry heat actually, there's two things. Number one, there is no moisture, so you don't have any kind of corrosion with instruments, as we all know that moisture does cause a problem. But also, most sterilizers, when you get to the top shelf, most things are wet. And is that really sterilized? Probably not. I mean, so when you think about something like this, they're less money. You could basically plug these things in and they're ready to go. That means no installer or technician actually has to install this for you, which that doesn't happen with any sterilizer. And then last but not least, it's way faster and your staff doesn't put any water in there, which is a big deal. They just have to clean it every once in a while, which is no big deal. But you think about it, you could do 160 pouch instruments in 21 minutes with one of these units, whereas a steam sterilizer is going to be probably double that, if not triple that. And nothing against those, they're great products, but again, most people, when I talk to them, they've never even heard of this technology before. And then when I talk to them about it, it's really me kind of having to explain it and then reprogram their minds that steam's not the only way. And when we really look at this, I mean, 65% less energy, no water, no dry cycle, no corrosion, no maintenance. I mean, it's a game changer. So the sterilization area also, I think, gets overlooked quite a bit. But it's more so these products that are coming on right now are, number one, it makes your staff way more efficient. And less touching to me is a big deal. So if your staff doesn't have to put water or drain it, to me, that makes the staff able to do other things they should be doing, which is basically focusing on the patients. So this is a great product.
And there's no, of course, sometimes over time, the steam coming out of the autoclave can kind of damage the cabinetry around it. That doesn't happen. So how does it compare in cost? If I were to have kind of a steam autoclave versus the dry heat autoclave of similar size, how does that compare cost-wise?
So there's two things looking at cost. There's the actual overall cost, right? And there's also maintenance. Mm-hmm. And so the overall cost, a good today's sterilizer, the name brand we all know, those are running about $8,500, $8,700 in today's world. Whereas these could be, there's a smaller size for about $5,800, or the bigger size was around $6,800. So that's a big difference in cost, but the real deal is the overall maintenance on them. So one of these is about $260 a year for maintenance. That's it. Whereas a steam sterilizer, I don't care what brand it is, if you look at the time and all the other things that go along with it, they're more like $2,500 to $2,600 a year in maintenance. Mm-hmm. So that's a big, big, big difference.
Yeah, that's awesome. This is something we're not taught. We kind of have all been like seeing steam sterilizers in our associateships, and we've been buying the same kind of brand that, for at least a decade or two now. So it's awesome you're bringing this up. This is a cool cool kind of change.
Yeah, I mean, really, like I said, I mean, the biggest thing was just trying to convince people, is this FDA approved? I hear that all the time. Like, of course it's FDA approved. I mean, so it's because we're so used to thinking steam's the only way, but really saving money on the corrosion of instruments is a big deal. But also, even when you're doing handpieces, if you think about it as water and oil mixed, no. And you're trying to push that steam to clean those handpieces through. And so that, again, it's just a much better way of doing things. And I would call it today's world. Scanners is a big area too. To me, scanners, the requirements have completely changed. Most dentists thought that the cheaper scanners were going to work for them because they're just doing single units. Really, the reality is everybody wants to be able to do full arch scanning when it comes down to it. And so scanners have really evolved, where to me, it's almost a necessity for a new office. I don't know one patient or staff member who wants to deal with quote unquote goop. No one does. And so the scanner options have gotten better and better and lower costs, and they're able to do a lot more to them than what they used to. And there's also no ongoing fees, which to me, the ongoing fees is not only it's the cost of the scanner, it's the ongoing fees too as well. So when you look at the different scanner options, you also have to worry about the very expensive recurring fees as well. So a lot of these scanners that are budget oriented, they really lifetime support. There's no ongoing fees. They include software that you can do design. So you have scanners that are starting up at $7,000 a piece to the higher end ones, which to me, they include photogrammetry and design software. It's a huge shift in scanners right now.
Yeah, and sometimes scanners even come free or discounted with some of the other equipment we buy. Is that correct?
Yeah, I mean, sometimes they're heavily discounted when you bundle with CBCTs. And so a lot of the companies who have, I would say, complete digital workflow offerings, they really make it almost to the point where you really should have it. But like I said, I mean, when it comes to your staff and your patients, to me, scanners are really a necessity right now. And I have not encountered one new startup that they didn't want a CBCT or a scanner from the get-go, because they know it's really today's standard of care.
Yeah, we also teach it through our method of case acceptance in our events. It's one of the many ingredients that we use to get dramatic case acceptance. So awesome. So yeah, this is a big change. I know that when it's bundled, we can typically get a better scanner at an affordable price. And of course, startups have this wonderful opportunity to bundle things because we're buying everything at the same time. But we can't buy it if we spend too much on the darn chair, or if we have side cabinets everywhere. That burns away our budget for this kind of stuff. Excellent.
Because you really want to scan every new patient coming through. And it's not, if a dental office as they evolve with more chairs, it's not they're going to have one scanner. They'll probably have more than one scanner. CBCTs, again, pretty much every dentist I talk to who do a startup, I would say 90% of the startups that I work with want a CBCT day one, because it really has become the standard of care. And so CBCTs have really changed too, as well, as you can see even in this picture. Now, where it used to be the 8x8, which is a small field of view, which basically discharge, was sort of being sold because it was cost less. But really now the costs have come way down, where I feel most people feel when it really comes down to it, the 16x10 is really the starting point when it comes to field of view. And really, when you're looking at what's happening with the CBCTs, like in this particular case, facial scanning is out right now, and that workflow is a big game changer, not only from the patient standpoint, but also from the practitioner when they're dealing with their lab. And there's companies now that give away the facial scanner with the CBCT, and I think it's just something that totally changes everything when it comes to the workflow overall, from their lab relationship with the patient relationship. Because when you're trying to explain something to a patient, most people don't understand x-rays, but when they see it associated with their face, they totally get it.
So there may be some dentists listening to this or watching this that haven't seen this before. So what we're looking at is really kind of the stitching of three types of images together. We're stitching a CBCT, so a three-dimensional x-ray, with an intraoral scan, so a three-dimensional scan, with an extraoral facial scan, so 3 dimensions on the face. And so we can see in that middle photo, all three are stitched together, and we're able to click into them and see them and drag them left to right, up and down, and for a patient or for a lab, we can see all of this at once. A lab can look at midline and alignment and cant, and a patient can understand, what's going on, what part, and it's super high tech. Did I say all of that correctly, Greg?
You did.
Yeah, that's pretty significant. It's if you haven't seen the combination of the intraoral, extraoral facial scan and the CBCT, it's a really cool combination that can, again, be not just something that sets you apart from everyone else and helps you get case acceptance, but it's just another way to make our profession fun, more accurate, have us focus on better procedures with more ease.
Absolutely. And really, the things when you're looking at CBCTs that to me are really, really hugely important is the expensive units. I mean, nothing against them, but you really want lifetime support and updates. You really want you're trying to minimize your recurring fees. Kind of like we talked about the scanners. When you have all those recurring fees, it stacks up in a hurry. And so you really want to have somebody who is going to support these products. And a lot of times these CBCTs companies have a one-day training. And to me, training for CBT is more of a walk, run, sprint. You don't know what you don't until you actually encounter something and see an anomaly. You really don't know it until you actually see it firsthand in your practice. And so you really want to partner with a company that actually has a walk, run, sprint mentality of training, because there's no way anybody can understand a software, especially with CBTs, in one training. So I really try to encourage people to make sure that that is how that particular CBT company is offering that, because that makes a big difference on whether or not you're going to use this product appropriately.
So, as you've kind of gone through these things, if we put this into practice for a bit, we say, okay, we have a budget. Let's just say I'm just going to come up with something. I've got 120 grand to spend on the core operatory equipment and the technology equipment. I'm just making something up. Mm-hmm. In the traditional way of building an office, following the recommendations of the big companies out there that we all know, 120 grand would get us, 2 ops of equipment and maybe like a pano or something like that, some kind of basic technology. Whereas what you've described is if we can reduce our cost inside of the operatory by not having the side cabinets, by having a different 12 o'clock cabinet, having different 12 o'clock delivery, having a different chair, those changes alone can enable us to now not only have a fully functioning op of new equipment, but we can also make room for a CBCT, not even the cheap one, but the one with the right field of view, and make room for an intraoral scanner and even a facial scanner. And even then, we might still have room as well for something like a 3D printing unit. And so this is a big deal because, of course, in our startup seminars, we teach how to save a couple $100 grand on construction and 100 to 200 grand on equipment. And what we do is we take all that extra money that we've saved and we go equip out all the ops with high tech. And we have a pile of cash we can spend on aggressive, healthy marketing, so that these practices that follow this other method, this other kind of strategy, they open with a bang full of really high-tech equipment. Whereas the doc down the street that went to the big company and got the normal brand, they barely had enough money to equip a couple ops, and they don't have any marketing, and they don't have any sort of thing like facial scanning. When you fast forward 2 to 3 years to both of those practices, the old model of overspending on the op versus the new model of investing in technology instead, you fast forward 2 or 3 years, and there's no question why our practices, for example, dentists are taking home $1 million a year versus the national average practice isn't even collecting $1 million a year, let alone taking home $1 million a year. And it all kind of starts with these types of decisions that you're describing, Greg, and working with a company like yours that actually shows these options and is kind of become an expert in this strategy of, hey, buy affordable things that work well, so you have money for the higher tech things we all want and need.
Absolutely. I mean, most practices that follow this method, I'll give you many, many examples where not not a year later, they're asking to add more chairs. They're literally asking 4 months, 5 months, 6 months, some even 3 months, because they have all this technology in their practice. Patients are motivated when they obviously see this. Patient care is way better. Patient acceptance is way better. Staff loves it too. I mean, majority of those offices are adding 1 and 2 chairs within 6 months or less, which tells you they're growing quickly.
Yeah, I don't know what's wrong with dentistry. It pisses me off because in any other field, if there were companies convincing you to waste $100,000 to $200,000, they would be called out. People would boycott those companies. They wouldn't be able to like be successful. But for whatever reason in dentistry, we've just called that normal. And what's abnormal is spending it correctly. What's normal is blowing it. I don't know how we got here, but it makes me sick to my stomach when I walk into these practices that are equipped the old way and they're struggling and they're missing stuff. I don't know how that became normal. So thank God there's people like you and me that are trying to say, hey, there is a much different way, a modern way to do this that will save you a ton of money.
Absolutely. I mean, you think about it. I mean, that's my point on there. You can get a 16 by 10 field of view right now for right around 40,000, where that's before was unattainable. And really, I mean, that's a big deal. Handheld X-ray. So that's another thing too, is that I think today's world is really, it's pretty rare that I have somebody asking for a wall-mounted X-ray, but you still see it. The biggest thing is that at the cost analysis, when you look at handhelds before in the past, they were hovering around that $6,500, even $7,000 mark. So they were definitely more than what a wall-mounted X-ray would be. Whereas now in today's world, you can get a handheld for right around $3,500 to $3,800 or under $4,000, let's call it, a really, really good product. And they weigh way less than they used to. So now they're about a fourth of the weight of the big boy, we call it handhelds. And so when you think about that, I mean, that makes things, it's actually more economical to actually get a handheld than actually get a wall mount X-ray. Because then when you factor in having to brace the wall with backing, put in all the power and all that other stuff, I mean, again, it just bloats your costs out where it's unnecessary. And so a lot of times we do have to convince people that handhelds are just as good, but most people understand that, but they still need, I think, a little bit of pushing. Because again, sometimes the older school way of looking at things was using a wall-mounted X-ray, which I get it, but to me, why when this actually overall costs you way less money?
Well, I mean, a wall-mounted shoots out 3 to 4 times as much radiation to the patient. It has all these construction costs because you got to put the backing in the wall and the electrical and everything. You have to maintain it because that arm it's on over time starts floating around. It takes longer to take X-rays with the wall-mounted unit because you got to keep leaving the room to protect yourself from the radiation. And the handhelds can cover lots of rooms. The wall-mounted ones can't go cover 3 or 4 rooms. So yeah, I could see like buying 2 handhelds being a much smarter investment than 1 wall-mounted, but it's just about the same cost. So I'm surprised that people are still pushing back on this. I remember, 15 years ago, we were using kind of the very first handhelds, and they weren't nearly as affordable as they are now, nearly as easy to use as they are now, and they were still the best option back then.
Yep. I'll have to have you advance a slide. My mouse for some reason stopped working, Scott.
Oh yeah, no problem. I'll advance it. There you go.
So 3D printing. I mean, 3D printing has come a long way. I would again say that most dentists, when looking at 3D printing, don't even realize that you can do permanent restorations in today's world. It's really evolved, and the biggest thing that's evolved actually is the overall cost. So there is obviously the premier 3D printers with everything you need with them are in that $25K to $26K range. But now in today's world, you could actually get a 3D printer, wash, cure, and everything you're going to need for under $10,000. And by the way, it can do permanent restorations. I think the biggest thing is just having a dentist, which I get it. They don't realize clinically that actually it's there right now, meaning permanent restorations. And it's really having them support that and really be comfortable with that. It's probably the biggest challenge. But it's not going anywhere. I feel that mills are kind of dead because of this. I mean, mill sales have plummeted. I think by somebody told me about 80% over the past 2 years, and it kind of makes sense because of where 3D printing is at. But you look at 3D printing, you can do so much with a 3D printer, from anything from dentures to aligners to permanent restorations to models to you name it. I mean, that's even a basic way of using a 3D printer. Even if you're using the basic sense, it pays for itself immediately.
Yeah, you can do all porcelain restorations on the 3D printer now, right? And there's a couple different clinical continuing education companies out there that do super high quality training to become very proficient at 3D printing. I actually spoke to I coach really successful dentists one-on-one, and I had two different meetings today, two different dentists. One of them was spending over 200 grand a year with Invisalign fees between his offices. Another one was spending 130 grand a year, and they could go to 3D printing the actual trays and save a fortune. And that is life changing when you think about saving that kind of money for the rest of their career. I've got full arch dentists doing 3D printed dentures, the original, provisional down to the final. And it's just pretty amazing what's possible now with 3D printing.
It is. I mean, it's really, I call it budget dentistry sort of here, because you think about it, if a patient is a cash only patient, for example, I mean, your cost for a tooth for 3D printed porcelain tooth, and by the way, they actually now have even zirconia based resin. So it's not a matter of, it's a matter of how fast these resins come out. So there's no limitation on them. And so to me, when you're looking at 3D printers, you also want to make sure it's open architecture, which means you can take advantage of all the really, really impactful resins that are out right now and coming out. And even this year, they're going to have more and more zirconia-based resins, but they're getting actually very close. They're already at an EMAX strength right now. And it's only to get better and better and better. So when you're looking at that, and if it's cash-only patient, and your cost is only $3, for example, for a printing out a 3D printed crown, there's some things you could do to make that, entice that patient to, because you're controlling your costs at this point. So I think it's budget dentistry is really for the patient to give them options. You know, here's my lab case crown versus here's my 3D printing crown. And you tell them the difference. But most patients probably are going to be open-minded to it. It's probably more the dentist is going to slow roll themselves because of just not being used to uncomfortable with those resins and the outcomes.
Yeah, it's interesting too when you look at Canada. In Canada, patients pay the lab fees. And so, and the lab fees in Canada, by the way, it's very common to see something like $350 a unit. The lab fees, in my opinion, have gotten out of control in Canada because the dentists aren't the ones paying them, the patients are. And so we see a lot of dentists in Canada now, including some I work with, they are printing and they are milling and they are able to bill the patient, for the lab. So instead of the patient paying $350 to a lab, they might pay $300 to the practice for that lab fee. So it saves the patient money. And now the practice has basically turned their 3D printing or their milling into a lab entity and are able to profit that way as well. That's what some Canadians are doing.
Yep.
That's awesome.
I mean, it kind of goes back to that lab too we talked about earlier. I mean, that's why you need that lab set up properly, because if you don't have it set up for properly for those 3D printers, I mean, and most people actually, a lot of people don't even get them because they don't have room for them. They don't know where to put them. So it's not that they don't want them; they just don't have the room for it.
Yeah.
So I think the overall theme we've been talking about is just keeping open-minded to budget-friendly products that the larger distributors simply just don't talk about. And really, the goal is to create a practice that staff members also want to work for high-tech practices. They don't want to work for a low-tech office. So they know it's way more efficient for them. And patients definitely want to go to high-tech practices. I mean, they think you're a better dentist at times when you have technology in your practice. Doesn't mean that you are, but that's just association with it.
All right. So we have not had any questions come in, which is really interesting, actually. If you have any questions right now is the time to ask, and go ahead and type them into the chat area. And while we wait to see if there's any questions, here's Greg, here's your contact information. Can you explain this a little bit?
Yeah. So any attendee, if they scan that code, can receive $100 supply merchandise credit from us. That's actually direct credit towards supplies. And you also, all attendees can also receive special pricing on equipment, as well as a free consultation on equipment choices. So if you are doing a new startup, then by all means, let us know. We can always do a consultation with you on where you're at and help you out with that project and help you save money.
That's awesome. So if I'm thinking about doing a startup where I'm about to buy equipment, I can do this. I can meet with you, and I'd receive special pricing on the equipment plus $100 credit for some merchandise. That's awesome. Before we dive into some of the questions, if any of you guys have heard of me or my business training events, the very intense business training events, if you thought about going to any of them, if you use this DHP code, you will save 25% off or more, which will pay for your flights, your hotel. And I can promise you that if you've never been to one of my events, it will be one of the most intense trainings on the business side you've ever received. Super valuable, a lot of content. All right, so we got some questions. One question, do you supply Canada? Or if not now, when are you estimating in the future? So what's the Canadian market situation?
We get asked a lot, as you know, even at your seminars. So we do not currently supply Canada. It's probably a matter of time at some point, but right now, unfortunately, in Canada, you're really relegated to 3 supply companies or 3 equipment companies. That's St. Clair, Patterson, and Shine. But it's a matter of time, I would say.
Do Canadians ever like buy something in the States and just bring it over the line and take it into Canada?
Absolutely. So they have a U.S. depot, if you will. And it definitely does happen for sure.
All right. So actually, can we go into that a little bit? So if I'm a Canadian dentist, how do I get a U.S. delivery?
You would have to have a warehouse or somewhere that would be acceptable to be able to deliver, obviously, equipment to to that particular site. But then you're going to be still responsible for all the tariffs and all that stuff, because eventually, it's possible that you could get caught up in that. But it is very, very possible. I have people who do it. That's not that I don't advocate it, but you can do it. There is definitely ways around it. But it's like anything else, it gets tricky.
All right. I bet they should reach out to you and talk if they need to talk about it. Okay. Another question. 2 people said, which chairs do you recommend? I missed the first part. Sorry. Someone else said dental chairs. Yeah, that was the very first part of this session. Are there specific chairs that maybe 1 or 2 chairs that you would recommend to a startup that is really looking to save money, but they still want something good and new?
Absolutely. I mean, there's several brands. I mean, but some of the brands that we do recommend, ADS is one. I love Belmont. They're made in Japan. Just don't break. I mean, but again, it goes back to, like we discussed earlier, open-mindedness to maybe doing 12 o'clock rear delivery, nothing on the chairs, those type of things. I mean, that changes everything. So reality is, I mean, there is options, but again, those are just the cost of the chair themselves and not including delivery. But if you have more questions, by all means, let me know. I can help kind of cost those things out, kind of give you an idea what that looks like.
Yeah. So if you kind of know what kind of delivery, you like, over the patient or side or over the head or rear, then that will impact what chair system you might look at and the overall cost. But chairs alone, you mentioned ADS, Belmont, some others that are very good and very affordable. Another question is, I think I missed the part on scanners. Did you say almost all scanner products are subscription based?
Not subscription based. Well, you mean, so the ongoing support is definitely subscription based. The ones that I recommend are not. That's like trying to get away from all of that. But some of the bigger names, I don't need to explain who that is. The top 2 companies, those recurring fees between $350 and $380 a month. That's a lot for a new practice to take on, and it doesn't go away, by the way. I mean,
so the answer is no. The answer is you can buy great scanners at affordable prices without getting hit with these constant ongoing subscription costs. Next question. Can same-day dentistry, let's see, I'm not sure. I think he kind of misspelled this, but he says, can same-day dentistry and decreasing lab fees recoup a CEREC investment? So I think he's meaning if I have a CEREC and I do same-day dentistry, does that and that decreases my lab costs, does that recoup the investment? Let me ask it another way. If we invest in milling or in 3D printing, is it common for the cost of milling and printing to offset all of what we would have spent on lab fees?
Has to do with volume, and the reality is a new office doesn't even have the volume to even do that. I think so. 3D printing obviously is cost way less. It's definitely more, I would say, appealing. But a CEREC really, and I used to sell CEREC for a long time. I mean, you really have to be doing between 12 and 14 units a month minimum to actually do that. But lab costs have come way down too. So really, I don't think I think it's more of a wash at this point. It's just the reality is if you really want to do same-day dentistry and that's what you want to do, then obviously you need to get the products to be able to do that. But I don't know many startup practices, unless they buy a used CEREC, have even cash to even do that, because there's no room in the budget.
So of milling versus 3D printing is way more affordable to do, and you're going to have a much better chance at getting rid of all your lab costs, when the dust settles with 3D printing than buying something very expensive like a brand new CEREC.
Yep.
Okay, next set of questions. Oh, a reminder to everyone, you can follow me on Instagram. That's in the chat here at dr.scott.leune. And also we have a dental CEO podcast. It's like super cool. When new podcast rolled out, we're interviewed some big names like Damon John from the Shark Tank. So check that out. Okay. Another question. What brand printer or scanner might you recommend? I know there's several brands you might recommend. What's one of them?
Printers, for sure. I love Shining 3D's products. There's things you have to understand about getting a 3D printer. The catalyst to all of it is really design. And so a lot of people think, oh, I bought a 3D printer, away I can go. The good thing is that a lot of labs are realizing that they can, as added value, they're doing design themselves. So they can actually do it remotely for you without you having to do anything if you don't have the time to do it. But the key thing is these inexpensive 3D printers actually have design software, which is you have to have some kind of design component, whether it's your lab or somebody else doing it for you. And so I really like Shining 3Ds because open architecture, 10 grand. I could have 3 of those versus the bigger brands when it comes to 3D printing. And really, the reality is it's not one printer you're going to have. It's more than one, because you can do same-day dentistry, by the way, with a 3D printer. So you can do that.
Yeah. So you mentioned something interesting. So 3D printing doesn't have to be you scanning, you designing, you printing. It could be this kind of intermediary step that says, hey, we send a lab to scan, they design it, and then we 3D print it. Is that correct?
That's right.
Yeah. Excellent. Another question is, which 3D printers are able to print permanent restorations, and which materials do they use?
It's a great question, Ken. So a lot of them already, so open architecture, you already have porcelain-based resins that have been out for, I'd say, almost 3 years, I think now. So now what's coming out is a hybrid where you have actually zirconia-based resins, which to me, that's kind of a bit of the game changer, because it obviously makes it more strength. So you're talking where it's very close to an Emax restoration right now, which is basically 430 to 440 megapixel strength, which is only going to increase very, very soon. So that Shining 3D printer I named off does it. Most do. Some do struggle with the permanent restoration, so that some of the other products, I wouldn't get the super cheap ones, but the ones I named off definitely do. Sprint Ray, obviously, I would say the more expensive unit that does it, but you definitely want something that can do permanent restorations.
So, if you're on this and you haven't started doing things like 3D printing, what you need is basically 2 things. You need someone like Greg to walk you through the latest options so that you can get something that makes sense. It's an appropriate cost, but can also do the types of restorations you want. That's the first thing you need. The second thing you need is you need to go to training, and there's many different places that can. Sorry about that. My computer froze. So there's many different places that can offer training so that in a weekend course, you walk out very confident in being able to do those specific types of restorations with 3D printing. That training, there's private places you can go for training. Also, the manufacturers of the 3D printing equipment have training courses, or they can send you to training courses. So those are the two things you need if you're unsure. You're not going to feel confident off of a webinar on a random Monday talking about it. You're going to definitely need to talk to equipment specialists and go to a course. But what's the result of that? The result of that is that for the rest of your career, you're able to do same day restorations at a high quality at the lowest cost available. And that's a significant result for you, for your patient. So it's something we've got to all go to. This is going to be how dentistry evolves for us. This will become the norm. Last couple questions here. Is there an alternative mill you recommend for CEREC, something cheaper than the MCXL?
Absolutely. Actually, a lot of CBCT companies do have mills. One of the things that I believe in is cloud-based software, and so a lot of the new mills that are around 50K, by the way, actually come with the cloud-based software, which means you don't have to have these crazy expensive computers that are also very proprietary to run your design software on it. So yes, there is. It really depends on what you want to do. If you're just doing single units, even pre-centered zirconia blocks, there's some mills that are out there for 50K right now that are really, really good and do a great job for you. But if you want to do like veneers and things like that, then you're going to need a little bit more, potentially more expensive mill. But again, they're all available out there for under 65, 70K. And this is new, not used, and it does the job. I mean, I get why people will want CEREC. I mean, CEREC has a great workflow, but now with cloud-based software, it's way more open architecture, and you're not having to buy these super expensive computers, and you're not landlocked to a very proprietary type of situation.
So I just want to point something out for everyone on this webinar. Think about your experiences talking to a sales rep. Have you ever had a company or a sales rep say, hey, these are actually the most affordable ways to get the job done at a high quality? I bet you haven't. So this is, again, it really upsets me that our profession is this way, but we don't need to buy these wildly expensive chairs, these side cabinets we don't need, these crazy expensive 12 o'clock units, and then be like lulled into spending mega money on milling. We need to buy stuff that works well, that's brand new, and that it's priced appropriately, like the Toyota version of our equipment. And that will give us the budget to buy into the technology we should be buying into, like 3D printing and scanning and CBCTs. And that should also result in us having plenty of budget in our startup to market well and to equip the right number of ops. So this is, to me, very impactful. And, Greg, we got one last question before we're going to end this. The last question was, what about refurbished versus new equipment? How do you look at that? And I'm going to start, and I'll turn it over to you. When you look at things like chairs, so often the refurbished chairs are chairs that used to be really expensive, and now they're 20 years old or 30 years old, and they've been refurbished, and they're still just as expensive as buying a brand new chair that Greg talks about. Rarely in our world are we buying chairs that are refurbished, because we'd rather have a brand new chair at the same price than one that's not brand new, but happens to have, a brand on it that people are used to seeing. Now, Greg, how would you answer the question with maybe some of the other things, refurbished versus brand new?
Well, with refurbished, there's a couple things going on. Number one, you don't really have a warranty at all. And so with a new, and really, it really comes down to the reason why refurbished came into play is because of the expensive chairs, Scott, we talked about at the beginning. We wouldn't even talk about refurbished if the chairs were actually economical, which is what we have been talking about the whole time. So reality is you have a brand new chair with a warranty that has all parts covered for always 5 years. And the other thing is you have to rely on somebody to install those. And when you're doing a new build out or design, if your contractor does not have the information about this refurbished chair, I've watched many times over where the junction box is in the wrong place because they didn't get that information. Whereas new, you have all that information. So there's a lot of things that could be a problem, which to me, like I said, it starts in the beginning because the expensive chairs drove us to look at refurbished. And if we just simply buy Toyota products, we wouldn't even have this discussion at all because you could actually have a new chair.
Is there a place for refurbished with other equipment like scanners or millers or autoclaves, or is it now where the price point is low enough and the quality is good enough that doing refurbished actually doesn't save you much money?
At the end of the day, I mean, is there a reason to get it? I mean, I get it. I mean, there's a lot of obviously ADEC chairs that are out there that are ADEC actually got smart. A lot of dental schools had ADEC chairs in them. So you saw a flood of them coming in because they have to flip them, I think, every 7 years, something like that, somebody told me. So now ADEC is now buying those back because it was hurting their own business because they're competing against themselves. But when you're looking at, yes, the refurbished equipment, I feel like you're getting somebody else's headache. And so there's a reason why they got rid of it. Not every single time, but the majority of the time. But then you're also stuck on technology products I just wouldn't do because you don't get the real good training because the manufacturer is not going to help you. Manufacturer has no reason to actually help you. You're not going to get all the updated software. So you're kind of stuck in this where you're never going to get the total way of having it done right because if you bought it new. And I don't see the savings, frankly, because everybody I know does regret it where they have a problem and then they're stuck. And it seemed like you're saving a lot of money. I would never buy from another individual because, again, you just don't know what you're going to get, and then you have no recourse whatsoever.
Yeah, I'd ask the question. I'm about to state my opinion here. I wonder if you guys listening to this think I'm being ridiculous, but it seems to me in dentistry that the refurbished equipment is the equipment we shouldn't buy anyway. It's either the refurbished chairs that were way too expensive, and now they're cheaper than their original price, but they're not affordable enough to not just get a brand new one that is affordable. Or we're refurbishing technology that, we really shouldn't be buying old technology when we're struggling. We need to get the latest technology with the latest warranties, the latest training and support. And so, refurbished in dentistry so often is just refurbished. The equipment isn't the stuff we should buy. Just because it's cheaper than it used to be doesn't mean it's the right thing to buy anymore. And I don't know if you find me ridiculous with that, those listening, but because I know there's a whole lot of old school dentists that feel like going refurbished is the way to save money. I argue you're buying something that's cheaper than it used to be, but it's still the wrong thing. I want the right thing that is brand new and updated so that I can move forward and not have anything break down, and it's what I need. And luckily that exists in dentistry. We just don't know about, most of us didn't know about it, but it does exist. Okay. We are just about out of time here. Before I turn it over to you, Greg, for one last word, I want to say thank you to everyone that's logging in and watching this. We're trying to make this series valuable for you. Lots of different topics. Some of them we bring people in like Greg. Sometimes we don't bring anyone in. Love to hear from you if you feel like this is valuable. We have other webinars that you can watch on lots of different topics. So look out for those. Follow me on Instagram so you get notifications. And of course, look at our Dental CEO podcast. Greg, before we end this, is there any last words of wisdom you'd like to say to us?
Thank you, everybody. I think like we said in the beginning, it's just keeping open-minded things. I mean, I think it's the biggest thing that most dentists struggle with is really reprogramming them in a sense that there is value-driven products and just trying to get out of their head that, not having those huge, big brands. That's really the hardest struggle, I would say, for myself and even you as well. I mean, it's trying to convince them that way, but reality is, I mean, it all works. I mean, I'm not going to sell a headache product because I don't want somebody else's headache. So, I mean, the reality is that's what they have to be, is more open-minded to value-driven products.
Awesome. Well, the chat is flooded with thank yous to you, Greg. So we all appreciate your time and appreciate kind of the direct and honest message here on how we can do better and save money and not be taken advantage of. Guys, thank y'all so much. Have a great evening. It is time to hop and kiss my babies good night. And I will see you next time on our next webinar in this series. Thank you, Greg. Thank you, everyone. Bye-bye.
Bye.